How does forced expiration technique, FET, work for CF airway clearance? Imagine trying to clear a clogged drain by blowing air through a straw. That's similar to what the forced expiration technique does for people with cystic fibrosis. It helps move thick, sticky mucus from deep inside the lungs to the larger airways so it can be coughed out more easily. The key is a controlled, forceful exhalation called a huff. And like a cough, a huff is gentler but still powerful enough to loosen mucus without causing airway collapse or tiring out the patient. FET works by changing the pressure inside the airways during exhalation. Inside the lungs, there is a point called the equal pressure point, where the pressure inside the airway equals the pressure outside. During a forced exhalation, this point shifts from the larger, sturdy airways toward the smaller, more fragile ones. This movement helps shear or break mucus away from the airway walls. When combined with the turbulent airflow created by the huff, it pushes mucus toward the mouth for easier removal. To do FET properly, patients start by performing huffs at low lung volumes, then gradually move to medium and large lung volumes. This sequence helps mobilize mucus from the smallest airways, where it tends to get stuck, to the larger airways where it can be expelled. Sometimes, patients combine FET with relaxed, diaphragmatic breathing to help expand the lungs and improve airflow. This combination makes the process more comfortable and effective. FET is often part of a broader airway clearance routine, like the active cycle of breathing technique, and can be used alongside devices such as positive expiratory pressure masks. These devices create resistance during exhalation, which can help keep the airways open longer. However, research shows that adding resistance devices during FET may not significantly improve mucus clearance compared to FET alone. Still, individual preferences and specific health conditions can influence what works best. One of the benefits of FET is that huffing is less tiring than coughing. It allows patients to clear mucus without putting excessive strain on their muscles or airways. This is especially important in cystic fibrosis, where mucus buildup can lead to infections and blockages that worsen lung function. By helping to clear mucus more effectively, FET supports better airway patency and reduces the risk of infections. In summary, FET helps clear the lungs in cystic fibrosis by using controlled, forceful exhalations to shift mucus from the small, hard-to-reach airways to the larger ones. This process involves manipulating the pressure inside the airways and generating airflow turbulence, making mucus easier to expectorate. Practicing huffs at different lung volumes, combining FET with diaphragmatic breathing, and using it alongside other techniques or devices can enhance mucus clearance. Always consult healthcare professionals to tailor the approach to individual needs and ensure safe, effective treatment. Proper technique and consistency are essential for maintaining lung health and reducing complications in cystic fibrosis.